A doctor walks into a room. They have 11 minutes with you. That is the average appointment time in most countries. 11 minutes to explain, diagnose, and move on. Most people leave with more questions than answers. They Google symptoms at midnight. They end up on forums that terrify them, or they just hope for the best. That is not a personal failure. That is a broken information system. And this week, something shifted. OpenAI just launched ChatGPT for Clinicians, a free AI tool built specifically for verified medical professionals. Doctors, nurse practitioners, healthcare workers, launched this week, right now. And the headline everyone is writing is about the doctors. But the story that actually matters is about you, because the same AI helping doctors research faster, you can use a version of it today for free on your phone in the next 10 minutes. And the people who figure this out now will be different. Not just more informed, genuinely better equipped to make health decisions for themselves and for their families. Let me explain exactly what is happening. ChatGPT for Clinicians is not a diagnostic tool. OpenAI is clear about that. It does not replace doctors. It helps doctors research faster, summarize medical literature, understand drug interactions, draft clinical notes. Think about what that means for a moment. A verified doctor now has a research partner available instantly at any time of day that can scan thousands of studies in seconds. That is a significant shift in how medicine gets practiced, and it is happening right now. But here is what most coverage is completely missing. The underlying model powering that tool, it is the same family of models available to you through regular ChatGPT. Right now, free tier, no subscription required. The difference is context and verification. Clinicians get a purpose-built interface. Regular people get a general tool, but general tools can still do remarkable things when you know how to use them properly. This is where things get genuinely interesting. There is a concept in medicine called health literacy. It means your ability to find, understand, and use health information. Studies consistently show that patients with higher health literacy have better outcomes. They ask better questions. They follow treatment plans more accurately. They catch things that might otherwise get missed. AI is the single most powerful health literacy tool ever created, for free, available to anyone with a phone and internet access. And almost nobody is using it this way yet. Let me give you a real example. Imagine your doctor tells you that you have elevated ferritin levels. Most people nod and leave. They have no idea what that means. They might Google it and find terrifying cancer forums, or they leave confused and do not follow up. Now imagine asking ChatGPT this instead. You type, "My doctor told me my ferritin is elevated. Can you explain what ferritin is, what common causes of elevation are, what questions I should ask my doctor, and what lifestyle factors might be relevant?" What comes back is not a diagnosis. It's a structured, calm, clear explanation. It tells you ferritin is a protein that stores iron. It explains common causes, from inflammation to iron overload to liver conditions. It gives you 5 questions to bring to your next appointment. It tells you which specialists might be relevant. You walk into that next appointment prepared. You ask better questions. Your doctor gives you better answers. The outcome improves. That is not science fiction. That is available right now, today. If you are finding this useful, consider subscribing for more practical AI insights every week. Now let me be honest about the limits, because this matters. AI is not a doctor. It can be wrong. It can occasionally present information with more confidence than the evidence warrants. Nilay Patel from The Verge said it clearly earlier this year. Language and intelligence are not the same thing. AI can sound certain while being incomplete. So the rule is simple. Use AI to prepare, not to conclude. Use it to ask better questions, not to self-diagnose. Use it to understand your situation, not to replace your care team. Within those limits, it is extraordinary. Here's another example that changed how I think about this. Someone's parent is prescribed a new blood pressure medication. They are elderly. They're already on 3 other medications. The pharmacist is busy. The appointment was rushed. Nobody explained the interaction risks clearly. That person can now open ChatGPT and ask, "Can you explain how this medication works, what the common side effects are, and whether there are known interactions with these other 3 medications I take?" ChatGPT will give a structured response. It will flag known interaction categories. It will suggest asking their doctor or pharmacist about specific combinations. It will explain what symptoms to watch for. That is a safety net, a real one, available at midnight when the pharmacy is closed. This detail often gets overlooked in conversations about AI and healthcare. The people who benefit most from better health information are not wealthy professionals with great insurance and unlimited appointment time. They are people navigating a system that moves too fast. people in rural areas, people with language barriers, people who feel intimidated asking follow-up questions. AI gives those people a voice, a research partner, a translator between medical jargon and real understanding, and that is a genuinely profound shift. Now let me walk you through 3 practical ways to use this starting today. First, before any appointment. Type your symptoms clearly into ChatGPT. Ask it to help you describe them accurately. Ask it what information your doctor will likely need. Ask it what questions are worth raising. You will show up more prepared. Your doctor will get better information. The appointment becomes more efficient. Second, after any diagnosis or new prescription, ask ChatGPT to explain the condition in plain language. Ask it what the standard treatment paths look like. Ask it what questions you should ask before your next appointment. Do not use it to second-guess your doctor. Use it to understand what your doctor said. There is a big difference. Third, for ongoing health research. If you are managing a chronic condition or caring for someone who is, ask ChatGPT to summarize recent developments in treatment. Ask it to explain what lifestyle factors the research supports. Ask it what specialists might be relevant to your specific situation. You become an informed participant in your own care, not a passive recipient. That changes outcomes. The research shows it. And with OpenAI now building purpose-specific tools for clinicians, the underlying model is only getting better at this, more accurate, more medically grounded, more carefully designed. Hold that thought for a second. We are at the very beginning of this shift. ChatGPT for clinicians launched this week. Within months, we will likely see more specialized healthcare AI tools, AI that connects with health records, AI that tracks symptoms over time, AI that flags patterns your doctor might not have time to notice. The people learning how to use AI in their health decisions now are building a skill that compounds. Every year this gets more powerful. Every year the gap between informed patients and uninformed patients grows. You are watching this video. That puts you ahead. What you do next is simple. Open ChatGPT today. Think about one health question you have been carrying, one diagnosis you did not fully understand, one medication you were never sure about, one symptom you keep dismissing. Ask it, not to diagnose, not to replace anyone, but to understand, to prepare, to walk into your next appointment with clarity. That is the real story inside the ChatGPT for clinicians launch this week. AI is not just changing how doctors work, it is quietly changing what it means to be an informed patient. The people using it well will have better health conversations, better outcomes, and a lot less confusion. Starting today, what health question have you been putting off asking? Drop it in the comments. Seriously, you might be surprised how many people have the same one. Chapter 0 o'clock. Hook 045, what OpenAI just launched 2:15, why this matters for regular people 4 o'clock, how to use AI as a smarter patient. 6:15, real examples that change how you think 8 o'clock, final thoughts.